Hello and welcome to Success Tips Global. It's July the 6th, 2023, and I have the pleasure of speaking with a super special guest, Dr. Linda Asamoah. Welcome to Success Tips Global.
Thank you very much.
So I know you are in Austria. Where exactly are you based? In what city are you based?
Oh, clearly I'm in Vienna. That's the capital of Austria. Austria is landlocked in the middle of Europe.
Hmm.
Austria is surrounded by 8 other countries, and yeah, it's not a really big country. It has a rich history, but I'm actually located in Vienna. That's the capital of Austria. Yeah.
Okay. And I know you are a medical doctor. What kind of medicine do you practice?
I'm a neurologist. Neurology is actually works with more or less, to give you some hints, like stroke patients, Parkinson, Alzheimer. Yeah, this is
Okay.
the field I do work. Yeah.
Okay. And what's your philosophy when it comes to dealing with clients? I know some clients can be difficult. Do you have any philosophy guiding your practice?
Well, I was born and raised up in Ghana, and we really have this kind of respectful attending to elderly, sick, as this kind of empathy had been inbred in me since I was young. So it makes it actually easy to work with people who are, as I said, like Alzheimer patients or dementia. They'll be challenging patients, but having an empathy and attending to the patients with respect do help me a lot to come along in such situations.
Okay. And what do you like about being a doctor?
Yeah, that's a good question. What do I like about it? I mean, it's really a complex field. It's demanding, and it helps me and challenge me to continuously learn and think critically and applied it so practically. And actually, these are all the fields that I'm challenging. And as a medical doctor, I always say it's like a candy shop. There are so many different things you can do. You can be attending clinically, do research, go for teaching. You have a broad opportunities. And for me, due to that is challenging, you continuously learn, and that's makes it actually the appropriate field for me. Yeah.
Okay. But are there any areas that are maybe unpleasant for you as a doctor?
Of course. I mean, if you deal with very terminal situations, like people who are young, just came in and they are near to death, and you have to speak it out and call their families and tell them these are really challenging situations. And during to the COVID time, we have like laws like the parents of the family members are not really allowed to come, or only one or two, and we have critical ill people. And I do looked over that and said, no, I mean, this is a critical ill patient. At least one person should come and say goodbye, or pay his or her tribute to them. And I often had some also discussions with the staff nurses, because that was not the policy that's supposed to be done. But in such situations, I was happy I could say, okay, no, I'm totally for the other side. The family members, at least one should come and say goodbye also. Also situations like that where people and you have to tell the families that you have beloved family member has no chance, or the prognosis is very bad. That really makes it sometimes tough to deal with. Yeah.
That's understandable. Okay, now let's talk about your educational journey. What is the process for becoming a doctor in Austria?
Oh, well, so You enter varsity after 8 years of secondary school.
Okay.
You have 4 years primary and 8 years secondary school. And after that, actually, to my time, everybody was entitled to study medicine as far as, yeah, you finished your high school positively, let me say. And then you get into the university and it's like a 6 years course.
Okay.
And after that, um, to my time, you will start like, we call it turnus here. This is when you are practical year, like actually 3 years after that, you be like a family doctor.
Okay.
We call it Allgemein Mediziner, as a general practitioner. And then after that, you can still go and specialize yourself, or you stay as a general practitioner. I mean, now they have changes a little bit.
Okay.
Like after university, there is a test for everybody called SIP. It's like an exam where they select the best out of, I don't know. And now we have like 8,000 people who want to enter university, and like 1,500 are chosen because we don't have so many places for them. But
Okay.
basically, that's the road to be a
Great.
doctor.
What about the environment in medical school in terms of your relationships with professors and other students?
As a when studying, that was pretty close because they have kind of methods where you were in like maximum 14 groups. As we
Okay.
have the large lectures and then small lectures as well, and there were really small groups, and that made it very good for us to integrate with the professors and also with your mates. There have been like friendships since there. That's I still I'm
Okay.
still having like, so that was pretty cool. And now one of my primary doctor is Professor Baumgartner, and he's in the field of epilepsy, a very well-known professor. And yeah, it's really amicable, and yeah, it's
Great.
I mean, there are also others as well, but it's not so like hierarchical. Yeah, so you have those who are professors, they have, of course, respected, and you have to approach them according to the way they are. But I mean, we still find possibilities to be able to talk to them or to chat with them.
Wow, sounds like a positive atmosphere. Now, becoming a
Actually,
medical doctor anywhere is difficult. So what kind
yeah,
of personal qualities or characteristics do you think helped you to achieve this goal?
yeah. So well, I can remember as far as I grew up in Ghana, there was like I have this mantra back in my head, like education is the key. It's really deep soaked in me, well. And of course, in Ghana, we do have possibilities to study medicine, though, but here it was actually easier, I find it, to enter because Ghana is depend on your pocket, but maybe also, of course, your brain and so how intellectual, and you can send your child to the university, but more or less if you can pay. And here, due to the system, so I find it very perfectly made. Everyone has the chance. You just have to learn.
Okay.
Well, and of course, for medicine, you have to endure. You have to be ready to learn, to sit and learn, to sit and learn, to sit and yeah. I find it like also I had this kind of, it was always like a dream in me, right? I would like to be a doctor, and I went first through nursing school. I finished it, and like 1 year nursing, I saw myself like, why? The doctors are here. What did different than me? It was they finished their high school. I finished my high school. Why am I not going to study, right? And I could see that it's not something that's not possible. So I started to enter, and yeah, it was possible. And I get it like, yeah, you really need a chance to enter, and you have to be, of course, courageous too. yeah,
Right.
to say I can do it.
Mm.
And when you have the chance, yeah, it's demanding, but you have to, yeah, you have to learn. You have to be ready to learn it. Of course, we swear also to that, that lifetime learning is, yeah, it's what you have to be ready to do.
Mm.
Well,
Mm.
but if you are a person who doesn't like sitting and learning, it's a little bit difficult for you
Mm.
to, I guess, to go through medical school or be a doctor. Yeah.
Okay, great. How much encouragement or support did you get from family and friends while going to medical school?
Well, while going to medical school, I can say, of course, my fiance, Clemens Lindinger, we met, and like a year later, we were pregnant with our first child, and I was in medical school. So it
Mm.
was like, wow, okay, how are we going to do? Normally, people do it differently. They finish their courses and get the kids. Ours were opposite. So it was he had really got my back. He helped me a lot because I had to study hard, and
Mm.
the kid was out and I was working part-time as a nurse too. I had like now night shift. I have to pump up the breast milk, and he will do that when I'm not around.
Mm.
With Jordan helped him out, and also my family, my mother and those days, my younger sister,
Mm.
they were also really supporting, and some friends also who were my colleagues when maybe I could not come to the university. I will
Mm.
text them, and they will try to manage my absence for me. Let me say it like
Wow,
that. So,
wonderful. So besides
uh,
family and friends, where else do you sometimes draw your inspiration from?
beside family and friends,
Mm.
yeah. Well, I cannot say I'm religious. I'm spiritual as well, and I have this kind of believe, like acting and doing the positive things, and it will happen as well. So like a mindset situation where I put myself into to focus, yeah, and to believe in myself, yeah, of course, also as our heritage says, as also for a Black person, to see, okay, there is no neurology doctors in Austria. Maybe that's the road to go. That inspired me as well. And also the community, they will be always telling me, you've been doing great and continue, and we rely on you. That supported as well, just to have this kind of, like people being happy for you. And
Mm.
it was also great. So I could carry that in me and focus if like strange times come in where, I mean, I never had this situation like I want to quit, I
Mm.
will say, but it can be difficult. Like one exam, if you have to go for another exam again, then you'll be like a little bit maybe afraid or so, but
Mm.
through positive thinking and mindset, like, yeah, it will be good. So I went through that, I can say. Yeah. Mm.
Great. You've mentioned Ghana a few times. What do you remember about Ghana?
Oh, please. Yeah, Ghana is where I was born. And when I came here, I guess it was something very, the German word is easier for me. It's called Sehnsucht. I always picture it as like it was the best time. So it was not the best time, but I had these pictures of being a kid, having a big family, and I could do anything. I come back home, I can run around with my friends. I was not locked at home, because the
Mm.
opposite here was it. When I came, I was more indoors,
Mm.
no friends to talk to. That time I was like 11 or 12.
Mm.
And a week after I reached Austria, I was in a classroom. Nobody looked like me. Nobody speak my language. And Ghana was, of course, in that opposite sense, it was a beautiful place to be. I had that kind of freedom I felt, and friends and peer group where I can talk to. I had the luck that I was like in a private school in St.
Mm.
Paul's, and I recognize that so it was really a tough and a good upbringing, because after 6 months or a year, when I could speak the language here, I was also one of the best students, because I always tell my kids as well, like in Ghana, they will say, next week you have an exam. Okay, or they'll not even say, this is the exam week and finished. You have to be always be prepared. But here, you know, your exam week, you know, like mathematics, the teacher will tell you, learn from page 10 to 20.
Okay.
And you have all the examples that you will have to learn. And this will also come to the test. There's no surprise, but in Ghana, it's opposite. Yeah. You might even learn and there will be other things coming. So it's much more tougher for students there, because you are not prepared for the exam. It's like, exam is here, do what you can to to prove. But here it's like you have been prepared for, and you just have to sit and learn. And if you don't understand, you go to the teacher, or you have an extra lessons, and yeah, they help you out. This is how I see, and I have positive, of course, positive images of Ghana. And I do have this kind of, and I used to have like pen pals, like so many of my friends, we used to write, and that was, yeah, it was a beautiful upbringing there. Yeah. So
How
it
easy was
was,
it to learn the German language?
how?
How easy or difficult was it to learn the language? Yeah. German.
Well, you always hear from the beginning, German is a difficult language. Deutsch is schwer, Deutsch is schwer. So it's also like, you know, like a mantra that is put to you first. So you'll be like, okay, it's difficult, yeah. But I was lucky, I can say again, like a week after I came, I was in a classroom. I was in like stage 1 again, and nobody could speak English. So I was forced, I was really soaked into this German. And like 6 months later, the words were coming. So
Wow.
I can say, like, after 6 months, it was possible. And I watched a lot of TV movies, I remember. And it was always in German, since like after 6 months, I could understand what they were saying. That was so mind blowing. Like before,
Wow.
you'll be like, okay, you just see how the actions are, and suddenly it's like, oh, your brain is like, okay, I know what they are doing or what they are saying.
You've got the
Yeah,
clue.
it's not easy. Yeah, my grammar is still a problem, but nowadays,
Okay.
thank God, we have some apps. And so also for me, German is still a little bit like mathematics, because they have so many different kind of declinations. Yeah.
Right.
And if you use some prepositions, you have to use a certain kind of form of, yeah, declinations, and that makes it a little bit difficult. But it's an language that is excellent. You have to speak to the points, so it's exact.
Right.
So my mother tongue is much more like symbols and describing, and you know, but he is like, what are you saying? Just say it out.
So
So
precision.
what do you say?
I said precision is important.
Yes, yes. And
Okay.
yeah.
When did you decide to make medicine your career? Was it back in Ghana or after you came to Germany? To Austria,
So
sorry.
I'm in Austria.
Yeah.
And I did it actually here, when so in Ghana it was there, but not so strongly. And after my secondary school, I went through nursing, as I said.
Okay.
And my aim was always to go back home and help and do something, also some social supporting. Then I did finish nursing, and yeah. So as I was working as a nurse, I saw like my passion was much more for the medical part. So the nursing part was also good to know. I guess everybody's supposed to do that once a while in his or her lifetime. And yeah, but my interest was much more into the how we function, how our body functions, how do we think, and that was that was really yeah, having me to go for medicine, to deeper into, yeah.
Great. Okay, let's talk about travel. How much traveling have you done, either for work or for pleasure?
Well, through my work, I've been traveling coming around. That's
Mm.
very nice. That's a good part of it. That we have some congress, some international meetings, and yeah, that makes it. I was just 2 weeks ago in London. It was in a beautiful hotel Hilton near to Canary Wharf, and
Mm.
had a very great time meeting colleagues from different places from Europe, and this is marvelous to meet foreign people, and you just connect and click and talk about what you're doing, and it was nice. And
Mm.
generally I have kids and they all also want to see the world,
Mm.
so we've been getting around. We've even planning to visit the States because my son might have like a sports scholarship, and
Okay.
this will be the next trip we are planning to. But and also for summer we would like to travel with a road trip with a car to
Mm.
Italy, to
Mm.
Toscana, so just to see the beautiful landscape. And traveling is very important. It's opened up our minds. It's
Mm.
broadened us. It's sharpened us, and you see different cultures. And yeah, I wish
Wonderful.
everybody has the possibility to do that. Yeah.
Right, right, right.
Yeah.
Okay. Now, no doubt many people look up to you as a role model. How do you feel
Yeah.
about that?
Yeah, I mean, that's as a role model. I mean, people see that, wow, what she has done, it was really challenging. Like she came here young, she was a nurse, she's a doctor, was pregnant, and still did her thing. That's, if I look back, I can see the efforts was
Mm.
what was putting into there. But when I was doing it, it was just something that it has to be done. It was
Right.
just in me. And I find it, beautiful and also supportive when people look to that and might also try to elevate themselves from
Mm.
where they are. This is actually my message that's I wanted to give to my people or young people who have been migrated here. Like, here, people, look,
Mm.
here is possible.
Mm.
So be courageous and get in. And I have like some friends who did nursing for some.
Mm.
They came here and did nursing. Like they never thought maybe they will do it, but
Mm.
I used to coach them. And I have like 3 people who did nursing. Yeah,
Wow.
after I did it, and that helps me. Also in medical field, different things that I've been doing. There are also some colleagues say, yeah, you were a role model. You gave me the support or mind support to elevate oneself. I mean, I'm still not done.
Right.
I have also my things that I would like to accomplish as well. But
Mm.
yeah, I'm happy where I am.
Mm.
I'm grateful, I'm thankful, and yeah.
Great. So then what advice would you give to young people who want to become doctors like you?
Yeah, generally young people from every race and color. I mean, in Austria here, it's possible though, but it has been a little bit difficult
Mm.
due to politics, that it's getting into that mm, realm that's only people who has money.
Mm.
Yeah,
Mm. Mm.
it will be possible for their kids to study
Okay.
actually.
Mm.
But due to my field, thank God we have this kind of political system that was more social,
Mm.
and
Mm.
just everybody has the same chance, just go.
Okay. Mm.
But if you want to go to that field, yeah, you better be prepared because they have pre-exams for that.
Mm.
They have courses for that, and you really have to take time and take it seriously
Mm.
and learn for that pre-exams, and engage yourself maybe in a hospital. Try to get to know to the field that you really want to go to,
Mm.
because it's not only learning, it's empathy, it's communication. You work with different people from different walks of life,
Mhm.
and your communication skills, you really have to be prepared for it. It's not impossible,
Mm.
because this is what I taught as well before I put my steps yeah, to this place. I was like, yeah, doctors has to be only people who has such a big brain and, you know, very, very intelligent. And yeah, I have seen them all. I mean, it's just having the passion to learn, to sit down, and people will tell me, wow, what you have done here. And wow, I say, in Ghana, there are so many people, they are just waiting for their chance.
Right.
Just give them the seats, they will sit down and learn
Mm.
for you.
Mm.
So this is how I see it, that
Mm.
there's possibilities there. You have to have the passion, of course, and you have to be ready to learn. My kids are like, no, mama, we could see all your books and uh
Okay, more
they are
generally,
not
and
into
maybe
it.
you've answered part of it. What advice would you give to young people who don't know what they want to do, who are just confused about their future possibilities?
I don't think there's such a certain kind of thoughts like this, because every stage has his challenges.
Mm.
And even being confused is kind of, yeah, they will evolve in them. In that confusion, they will find their way. Because as I said, after high school, I did like African studies, political science, and nursing. Then with the age of, like, I think 26, 27,
Mm.
got into the field to study medicine, where I
Mm.
knew, wow, this is my passion. So I needed kind of some fail, not, I will not say there are wrong steps, but it's
Mm.
helped me to get to where I wanted to be. This is how I see it. So I guess they still try to find in themselves, try things. Yeah, that's maybe it's not 100%. They are not feeling like this is the job or this is the studies I want to do, but just try it. Within that, you find your answers as well. And I believe everybody has his, purpose here, and finding it is the most beautiful thing that can happen to you. But it's a journey. It's not like you turn out from high school and you know what you are doing. Just I guess very few, but they also need experience. I mean, 18 years, 19 years of age is actually nothing. You need to have the experience. And here they have also this gap year is not bad, where people will just have a year off and try to find themselves and, try to see where they fit in. And I guess, yeah, my son is also in this age now, and
Mm.
I'll be like, try to go for medicine. It's a stability. You get a job, and he will tell me, no, mommy, I cannot carry these such books. And
He has his own interest, right?
he has his own interest, and I have to, yeah, back him. Sometimes it's
Okay.
difficult, but it's his life. Yeah.
Okay, you've already said a lot. Do you have any final message you want to share with the world?
Well, though, thank you very much. I mean, somehow we are in the same field. You left Ghana very early, and I remember you as a brainy. You were always doing well, and yeah, somehow I also look up to you. Like, wow, um, Uncle Everett is well. He's always pursuing for more, and this is also something that's, I forgot to say. It's also supportive to have, somebody else in the family who sees education and continuously learning as something that's so beautiful. Yeah, and you are always trying to give it to the world and give it to the family, and that's what I find is also a lot of respect for that. And also, thanks for this interview. And
Thank
yeah,
you. Thank you so much. Yeah.
yeah,
Yeah, thank you. That's all I can say. Thank you very much for taking the time. And
yeah.
we'll talk
Thank you
again
too.
later. Bye
Okay.
for now.
Bye.
Bye-bye.